If you're like most of us, you've been around long enough to know that life is full of pain points. Peaceful Hope Hospice and Palliative Care is here to help you overcome those pain points and live a better life. We're not just another hospice care service. We're a community of people who have been there, done that, and are still here to help you through it all. Because when you're in pain, who else do you want by your side? How does someone initiate hospice care? Many individuals and families could benefit from hospice care, but are unaware of how to access hospice services. Some are afraid to discuss it, some wait for a physician to suggest it, and some don't know that they can initiate hospice care on their own, as long as eligibility criteria are met. At Peaceful Hope Hospice, we hear from many individuals and families who tell us they wish they had known about and used hospice services earlier. It's important to let healthcare providers know that hospice care is a preference and not wait for them to raise the topic. How to qualify for hospice services. Self and family referral is possible. The person and/or family may contact hospice directly, but eligibility must be confirmed by physicians prior to receiving care. If a physician does not agree to refer for hospice care, or if the individual has not seen a physician for many years, the person may still be eligible for hospice care, and they or the family members may reach out to a local hospice provider for more information on the admission process. What services does Peaceful Hope Hospice and Palliative Care provide? Our staff are available 24/7 and may make home visits at any time in the day. Time and services of the care team, including visits to the patient's location by the hospice physician, nurse, medical social worker, home health aide, and chaplain or spiritual advisor. Medication for symptom control, including pain relief. Medical equipment like a hospital bed, wheelchairs or walkers, and medical supplies such as oxygen, bandages, catheters, and many more. Physical and occupational therapy. Speech-language pathology services. Dietary counseling. Music therapy. Any other Medicare-covered services needed to manage pain and other symptoms related to the terminal illness as recommended by Peaceful Hope Hospice team. Short-term inpatient care, when adequate pain and symptom management cannot be achieved in the home setting. Short-term respite care for family caregivers, temporary relief from caregiving to avoid or address caregiver burnouts. Grief and loss counseling for the patient and loved ones who may experience anticipatory grief. Grief counseling is provided to family members for up to 13 months after death. Access to these services is determined on a case-by-case basis, depending on assessment of the hospice team, goals of care as established by the hospice team, and disease progression and symptom burden. Length of stay. There are strict federal rules that hospices must abide by that address length of stay in hospice and who is eligible. Possible changes to care may occur due to extensions. Although medical eligibility generally relies on the physician's opinion that the patient's life expectancy is 6 months or less, neither the patient nor the physician is penalized if the patient lives longer than 6 months. The patient can be recertified for hospice care, provided medical eligibility is validated. Discharge. If a patient's condition stabilizes or improves sufficiently, they may no longer meet medical eligibility for hospice services. At that time, the patient is discharged from the hospice program, and their Medicare benefits revert to the coverage they had before electing hospice care. Revocation. Sometimes hospice patients may choose to pursue curative therapies, such as entering a clinical study for a new medication or procedure. In order to do so, the patient must withdraw their selection of hospice care, called revocation. At Peaceful Hope Hospice and Palliative Care, we believe that our patients' lives are worth living, and it's our mission to help them live life to the fullest. We're not just talking about physical pain. We're talking about emotional and mental pain as well. We provide a safe space for your loved one to rest and heal, where you can talk about your loved one in peace and learn how to honor their memory in a healthy way. If you want to learn more about us, you can visit our website at www.peacefulhopehpc.com or call us at 972-803-3433.